So this is the first of a new kind of like series of videos that I want to start to film for you guys. And the real purpose is just the fact that a lot of things that I like talking about and a lot of the things that really set us apart at Game Changer PT require a lot of context to the discussion that can't necessarily be stuffed into a quick 30-second or 60-second clip on Instagram. And that is primarily where you'll find us unless you were to see us in person. So I decided to just start to record some more long form content. I'll throw it up on YouTube. If in the future this turns back into more podcast form, getting guests and doing interviews, more than happy to do that. But I really just want to see like how I like this, see how this kind of naturally flows. And if you guys like it, please feel free to either comment below or message me directly. If there's ever any specific questions that you might have that you'd like me to make a longer form video on, again, same thing, leave a comment below or message me directly. But today, because I had the time, what I wanted to do was just honestly see ChatGPT's idea of like what some talking points might be. So the first prompt I put in there was basically what's the most common things that people are told about their injuries. And I kind of came up with this list that we do see and consistently hear people coming in having been told these things. So I want to just kind of give my perspective on where the issue is in some of these recommendations. So the first 2 points that it makes, which really go hand in hand, at least in the stories that we get told, are basically just to completely rest from activity and to take anti-inflammatories and just see how it feels. And as you'll see with pretty much all of these talking points, in isolation, these things aren't actually an issue, right? Like, could it conceivably be true that if a specific activity continues to cause pain, we might need to spend a period of time taking a step back from that activity? Yes, I ask people all the time for a period of time to do less of something to provide us an opportunity to make progress with the intention on reintroducing that thing. And is it possible at any point in someone's life where something like an anti-inflammatory, some type of medication could be beneficial? Again, sure, it's possible. The problem falls into the lack of context of either understanding why that specific individual patient is experiencing the pain, right? Or the context of what do you do in conjunction with rest and anti-inflammatories, because otherwise all you're allowing to happen is have time pass. And as with most things, as time pass, either things heal or become less symptomatic purely because you haven't actually stressed the area, which again can be useful. But the question becomes, once you reintroduce that stress or that activity that was leading to that symptom, how prepared are you to be able to execute in a way that isn't going to create the same exact issue in the future? So that's the one huge point that is missing in these things. It's not the fact that relative rest of reducing that specific pain stimulus or potentially doing something that's more topical or even like an anti-inflammatory just to help with the immediate symptoms. It's not that those things don't have its place, because almost everybody is looking for any type of immediate relief. But in most cases, especially with the types of patients that we end up seeing, more active people, more athletes, people that are trying to use their body, if you are having pain specifically with a particular movement or activity, we need to tease out what is it about that activity that is causing pain, and not just rely on sitting until the pain goes away and then expecting us to be able to jump right back into the same activity without any limitation. The next point ChatGPT brings up is you just need to stretch more. And I actually wonder, like, if everybody were to look on ChatGPT, if they would all get the same list, or if this is somehow prompted based off of my history of searches, because some of these things are pretty spot on with the things that we hear here. And the thing about stretching, which I think anybody who's ever talked to me, it's almost a joke that they think that I somehow am so against stretching. And again, it's not that I'm against it. It's that I tried to provide the context so that people could understand what it actually is and is not doing and where it potentially fits. If somebody were to tell me they stretch and they like the way it feels and they feel good after, I'm not going to take it away from them. However, most people, at least when I speak to them and they talk about stretching and what their goals are, they are stretching with the intention on increasing mobility, which that is not what stretching will ever do, because your ability to express mobility or range of motion at particular joints comes back to the position, the resting position of the joint that you're measuring. Static stretching, so just pulling on muscles, is not necessarily going to change that. The really quick analogy that I use for most of my patients, or the visual that I like to use just to kind of paint a picture for them, is if you were to take a rubber band, which I don't have one really close to me, if that rubber band was like a brand new, super tight rubber band and I were to pull it, it's going to feel tight. So conceivably for that scenario, if I were to continue to pull it, eventually it's going to loosen up. Okay. Now, if I were to take that same rubber band and I were to pull it as far as I possibly can to the point where it's completely at its capacity, and if I were to pull any further, it's going to snap, at that moment in time, it's going to feel tight also. Now, if I thought the solution to that rubber band feeling tight were to pull further, then would I expect that sensation of tension or tightness to decrease? Most people respond, of course not. That's right, but the symptom, the sensation in both extremes is tightness. That's the reason why that is not enough information to know necessarily how to treat it. What we really need to be able to do is identify whether a muscle feels tense due to basically both attachment points of the muscles, so both bony attachment points being in a position that is putting in more of a shortened position, or if those attachment points are moving further away from one another, in which case it's actually going to be pulling on the muscle in a resting position, and both would require a slightly different strategy in order to reduce that tension. In almost all of those scenarios, at least with my own treatment bias, it does not require static stretching. Now, there is movement. There's specific movement and mobility drills that can be effective, and if we just oversimplify things and somebody wants to call it a stretch because that's what they perceive themselves as doing, I don't have a problem with that. But I always like to provide the context so that if somebody were to leave here and not necessarily remember that thing that we went over, even though we send them recap emails and videos, but either way, if they don't remember what that thing was and they're trying to look for something else that is comparable to that thing, if they remember it as a stretch, that is what they are going to look up. So that's the reason why I really go out of my way to try to educate people on what it is that we're doing for them. The next point, which this probably is the most common thing that I see, that I'll explain why I'm not a huge fan of this, but is it says, quote, "You're weak, you just need to strengthen it." And I think that this can be a touchy subject because I think that there are multiple camps in physical therapy, healthcare, personal training, whatever similar field you want to speak to. Because what I'm never saying that strength is not valuable or is not needed. What I'm saying is that the blanket solution to someone's pain of just getting stronger, which is so frequently stated, is so misguided because it would basically be making the assumption that anybody who is strong would not experience pain or an injury, right? So do professional athletes get hurt? Do bodybuilders get hurt? Of course, right? And we know that that's ridiculous. But basically someone's response with that would then be coming up with a different explanation as to why that person experienced pain. And that's kind of the point, right? Is that it's not enough. Now, what we want to understand is if somebody is presenting as weak, and I say that in quotes because I think there are a lot of different ways to present as weak or present as unable to express the ability to produce force, which I know just sounds like saying the same thing but in 10 words, and it kind of is, but it's a little bit more specific. The ability to produce force. Then it should take 6 to 8 weeks, by the research, to make any type of meaningful change in that. But we all know that there is the potential for someone to either feel stronger or express strength better within a single session. So what's really happening? Well, we are influencing the strategy that person is using to execute that movement. Okay? So if we're able to better express the joint position, mechanics, and intent of a movement, you have the ability to actually improve someone's force production in a very short time. But in the same light, that also works in reverse. So someone has the ability to present as weak in our most traditional ways of testing somebody's strength. I don't care if you're using technology, if you're using your hand, if you're just using the weight on the bar or the dumbbell as kind of being your metric. But somebody has the ability to present as weak based off the position they are attempting to express that movement in. So, could the ability to produce strength or the ability to produce force be a valuable metric to track in conjunction with other tests to tell you that you're making meaningful change? Absolutely. Right? And especially, I shouldn't even just say especially for athletes, really anybody who is trying to get back to normal activity requires some ability to be able to produce force within different contexts, right? And that could be a 12-hour conversation in itself. However, if we were just to blindly layer on strength without having an understanding of what we are putting that on top of, then we have the ability to reinforce negative habits. And I try to say that and provide as much context as possible because I think it's very easy to try to twist those words as if somehow we're saying that strength is a bad thing. It's not. But if we start to layer that on top of the movement strategy that may be putting stress in undesired areas, then that strength is not going to magically correct that thing. What it's going to do is it's going to continue to reinforce it, and it has the ability to make it harder to change those things. So again, context is needed for any of these discussions, but if you're ever told you just need to get stronger and you're not provided any more context to what that means or what that means specific to you or how you even track what it means to get stronger, then it's probably a very cookie cutter blanket statement that's said to everybody. And it's probably a sign that they don't have a deeper understanding of what it is that they're trying to do with you. At least that's my opinion. Next one is it's because of your age slash arthritis slash degenerative disc. So we'll call this you're just getting older. And there are certain things that we know happen with age, right? There are certain things that are just completely out of our control. And I think that there is some relevant changes, some predictable changes that occur for everybody. However, there's some other lesser talked about things that play a really major role in why we're experiencing injuries with aging. So I'm going to use an example. I grew up playing baseball, played in high school, played in college. Now I play men's softball. And I play in a league that has everyone from 20 to 70 years old. And pretty much everyone over the age of 30, if they experience any type of injury in this league, the first thing they say is, I'm just getting older. And while that is actually true, that they are just getting older, what they completely ignore is the idea that they are not consistently moving and using and preparing their bodies to do the activity that they're asking themselves to do for six to 7 months, because this league's ridiculously long. Right? They're not preparing their body to do that activity anymore. When they were playing, if they played baseball growing up, they had practiced 5 or 6 days a week. They were constantly throwing every single day. They were taking hundreds of swings. They were playing different games. They were probably playing other sports outside of those practices. So they were using their bodies in very specific ways that, whether they did it with that intention or not, was preparing themselves to take on the stresses of that sport. Now, what comes with aging? Well, some people start families, so they have kids at home. Everybody has a job, right? So the context of that job, whether it's a physical job or the exact opposite, where they're sitting at a desk, or maybe they have a long commute, right? Maybe there's other things that change. Maybe they've gained weight over the years, or maybe they're really good at staying in shape. Maybe they're not somebody who exercises anymore. Whatever it is, there's a lot of other things that change as we age that weren't necessarily in place when we were younger. So those things, on top of time passing, So at 60 years old, I have 60 more years of volume on my body than at 15 years old. But all of those changes play a role in just how I'm able to move as a human being, absent of the sport of softball. And then I'm asking myself to do this very specific activity, right? Getting into pretty extreme positions. And I'm asking myself to do that at whatever frequency you play the sport. So, yes, you are getting older. No, getting older in isolation is not the reason for your issues. Now, if you want to talk about arthritis, degenerative disc, or any other chronic changes, go one step further and say, why did those things happen in the first place? Well, repeated stress or load to an area over an extended period of time creates chronic change. Okay, take that one step further. Why was there repeated stress and load applied to those particular areas? Because what happens is you are almost never aware of something until you feel that symptom, right? So these things, these tendencies, these strategies were in place long before you ever experienced a symptom or had a need to receive that MRI. So the visual that I create for people when we talk about like a chronic change is, imagine I were to give you a 1-pound dumbbell and I were to tell you to do a bicep curl, right? You would probably think nothing of it. You wouldn't even notice it. You wouldn't even feel your bicep. Let's say I took that same 1-pound dumbbell and I made you do a million bicep curls on the same arm, right? You're probably all already thinking about what you feel. It's like you could barely lift your arm, like your bicep probably feels like it's going to rip out of your body. Okay, well, it's the same 1-pound weight. It just feels like 1,000 pounds now. So the same very small stress applied over enough volume over enough period of time has the ability to create a major change. And you aren't going to feel the first rep. You probably won't even feel the first 15, right? I don't even know what rep it's going to take until you start to notice the fact that you're doing something challenging. But then after that challenge occurs, each next rep becomes more and more insurmountable. That's kind of how stress applied to the body over a long period of time works too. So once you feel that thing be limiting, it then makes it even more noticeable how many things beyond that point become limiting, or it just becomes increasingly more challenging to get back to that baseline. So let's say you drop that dumbbell. How long until you're going to be able to repeat those million reps with that bicep curl? Right? There's going to be a recovery element to get back to even letting 10 to 15 feel like weightless again. So it's not fair to blame age. I think it's a convenient excuse for some people because they want to take some of the responsibility off their plate. That, yeah, some of these things take time, take energy, take financial responsibility to be able to do these things the right way. Absolutely. Blaming something on age because we can't change that kind of takes the responsibility out of their plate, and then they don't have to acknowledge the fact that they're capable of doing it in a different way. Next one, which I don't really love, it says you need orthotics, better shoes, or a brace. The reason why I don't love this, kind of like I said earlier on, is the fact that it's not providing any context, right? And that's really the issue with all these things. So I've prescribed orthotics. I've helped people fit themselves to good shoes. I've given braces. I've taped people, right? But what I don't do is I don't do those things and then just tell somebody this is going to solve all your problems. I explain to them that we are doing this with a specific intent on what we're trying to teach their body to do. And the intention is so that provides the assistance that then allows them to use a different strategy of movement or perform things a little bit more effectively or efficiently so that we can do something else more meaningful. Now, sometimes this is something that we have to prescribe, and then we should have them continue to use it in perpetuity, depending on what we're talking about. Other times we're using it as a means to an end where we're only going to use it until we're getting to a point where we don't need something anymore. So I don't have a problem with these things. Part of my problem when somebody is given these things is when there's no rhyme or reason as to why they were given it. For example, without poking on any brands or names, I've heard of people just being told, this shoe is a good shoe for this, and it doesn't really work that way, right? Like each person's foot could benefit from a different style of shoe. Each activity might benefit from a different style of shoe based off of what it's assisting in your ability to do. So it's helping your foot structure. It's helping you push into the ground more effectively within the context of a specific activity and within the context of your body's presentation. So there's no just like arbitrary perfect brand of shoe for everybody. Orthotics, almost anybody that goes to certain podiatrists are just immediately given orthotics. Sometimes it's absolutely the right solution. Whether or not the execution in the type of orthotic they get or the fitting, like that's a different discussion, right? Other times it's reinforcing the problem. And that's because all foot and ankle issues aren't automatically solved with orthotics. So what we need for the people that would benefit from orthotics, we still need an orthotic or any type of insole that allows the foot to still move. We can't create this rigid, hard orthotic that just fixes the foot in place, because the foot needs to move and deform depending on what we're asking it to do. So by putting people in these like very firm, hard orthotics, these kind of one-size-fits-all type devices, it has the ability to basically trade off one issue for another. So as one thing resolves, that person perceives that as being a success, and then they don't even attribute that new thing that comes up as being due to this orthotics influence on, if not the foot, potentially the rest of the body. So I have nothing against orthotics, shoes, braces, right? But we want to make sure, are those things actually creating the influence that we're looking for? Are they prescribed appropriately for the individual? And are they actually doing the thing that we want them to do, which would require an assessment both before and after. We would need to have proof that this is creating the change that we want. Shoes is a little bit of an easier example. I will have people bring in 3 or 4 different styles of shoes that we'll pick out together, and we are assessing things to determine which one is the best fit for them. And a lot of times someone will immediately try one on and say, this is definitely going to be the best. And then when we actually assess a couple different kind, even though that first one was an improvement compared to their baseline, we found one that even provided a better improvement. And the only way we would have known that is by having this collection of shoe types and by actually assessing and determining the best fit. So yes, it's an extra step. And again, it requires some time, money. Obviously they return the ones that we don't use, but it requires a little bit more work than a lot of people are willing to do. But if we're just going to make this assumption that there is a one-size-fits-all approach, no pun intended, to shoes or orthotics, then a percentage of people are going to guess right and have great outcomes. And then there's going to be a percentage of people that start down that spiral of thinking that orthotics didn't work for me or this shoe didn't work for me. It's like, no, it just wasn't the right fit for you. The right process wasn't executed in order to actually make that thing work best for you. The next point ChatGPT brings up is you'll just have to live with it. Now, I would really hope nobody in the medical field would ever say this, but I have heard patients been told this too. I've heard patients been told this by their doctor, by other physical therapists, by chiropractors. And in my experience with the people that I see, what this really can be translated to or defined as is that individual does not have these skills to be able to bring them any further than what they brought them to. There's a difference in I cannot help you any further rather than saying you are incapable of getting better. But I think that there is a subconscious ego in almost all health professionals that do not want to feel like they are incapable of doing something. So then they place the blame on the person's body or injury, which has a lasting effect on that person. 10 out of 10 times, I would rather be the one to take the heat than ever make somebody believe that they are broken or believe that they are incapable of improving. Things are allowed to be complicated, they're allowed to be complex, and they're allowed to be challenging. They definitely are with a lot of people that we see in my clinic. But, as with all these points, we need to provide context. If somebody is struggling to improve or they're hitting a plateau, you want to help them tease out these details to see what is it that is or is not working, why is it or is it not working, and what things do we have to try differently to try to overcome those challenges. Or maybe, in extreme cases, we have to accommodate for those things to put them in a better position for success. There is always something that can be done. It does not mean that you are always going to be the hero. But just because you aren't the hero in the story does not mean that that person does not have the ability to improve. So there is never, ever going to be a scenario where you have to live with the pain that you're feeling, right? Just sometimes it requires a lot more attention to detail. I would argue always. But if you were ever told that, I would hope that there would be an alarm that goes off in your mind, and I would hope you would start to search for somebody that's able to provide a little bit more information for you. The next point, your pain is in your head. And I actually have had a couple people told this before, and a lot of it is obviously really bad bedside manner, and again, no context provided. Your brain absolutely plays a role in how you experience pain. That does not mean the pain is in your head. I do believe that, kind of like with the last point, if somebody got to this point, I think that it is a frustration in themselves of not being able to help that individual, so they need to deflect and make that person believe that the pain is not real. I have worked with people that it's a hard conversation, but that I've recommended should work with a mental health professional, but that is not me telling them that the pain is in their head. Their pain was still very real. What they were experiencing was very real. There were still things that we could work on to help improve upon the way that they were absorbing and producing stress throughout their body. But there are times where the way that we talk to ourselves, the way that we cope with certain things, the way that we interpret and define certain things is going to impact our experience with what we're feeling. So the way you talk about anything is the way that you're going to feel about it. And a lot of people have very negative self-talk, or the second something doesn't go well, they immediately throw out everything that was working. So a lot of times there are mental practices that will go hand in hand with what we do that is going to help somebody navigate the process of improving over time. I always said, if people from the day they were born, this will never happen, but if people from the day they were born had three people in their corner, a mental health professional, a nutrition coach of some kind, and a movement/exercise coach, whether that's the world's greatest physical therapist or personal trainer, like, I don't care. But if they had those three people in their corner, three quality people that actually know what they're talking about, not just people with those credentials, then I would argue, and this is my opinion, that you would need far less medical doctor and orthopedic visits in your lifetime. Those three people: nutrition, mental health, movement. If you can have those three pillars under control over your lifespan, I would argue a lot of other things that have become commonplace in our society would happen far less. That's my opinion. Unfortunately, we can't test that theory because that would probably be unethical by all standards. The next point, I think there's two more points. Next point is your posture is bad, sit up straight. And again, another thing that provides no context. Is posture real? Yes. Can we consciously change it? No. Is it the reason for our pain? That becomes a super complex conversation. I think posture is a byproduct of a lot of things changing within the body as a way or a strategy the body is attempting to move through space. So posture can be insight into how the body is moving. There are predictable changes that occur that lead to what we see on the surface. So we look at posture, but we're not looking at posture in the way that we're telling somebody your shoulders are rounded forward, so that means that your back is weak, or your head is going forward, so that means your neck is weak, so we need to do more of this. We're not just trying to fit people into this arbitrary, perfectly vertical presentation. We're trying to tease out what is happening that is leading to their need to present that way. So I don't need that static posture to necessarily change, but it often is a byproduct of attacking the right thing. So again, kind of one of those things where if somebody brings this up, it doesn't turn into like a quick 2 or 3 word explanation. You have to provide context as to like what these things actually mean, because how many people, right, especially my generation, our parents were always, you're slouching, sit up straight, right? Or your back is arched, so tuck your hips under, right? Everyone just thinks that there is some like intentional way to just reverse a postural presentation, and that is not necessarily true. But there is something that led to that person's presentation, or there is something that led to that postural presentation, and those things can be relevant. Not necessarily saying that that is due to your pain or that is causing your pain, but that thing has the ability to impact how you move, and how you move has the ability to impact how you're absorbing stress, and then that stress has the ability to play a role in why you're feeling pain. There's always going to be layers to this. I tell everybody, you don't need to move perfect to not have pain. You could move terribly, whatever that means, and not experience pain. We can't necessarily predict pain. However, when somebody already is coming to us telling they're experiencing pain, we can reverse engineer that and have an understanding of just how you moved and create this profile of you as a person, and say, moving this way has the potential to be putting this type of stress that is leading to this type of compensation, that is leading to this type of symptom that you're feeling, or is forcing you to work around this in order to execute this activity. And then you do that enough times, and that's going to play a role in why this tissue failed, or why this inflammation developed, or why the stress was applied to this and created this type of chronic change. And it's always going to be that complex. It doesn't always need to be presented that way to somebody, but everything matters always. Everything matters always. Last point, don't squat, lift, or run anymore. And it fascinates me that this stuff is still said to people, but it is said. I had a primary care physician, my own, say to me one time during a physical, just so you know, as you get older, you won't need to worry about strength as much because you're not trying to be a bodybuilder. You should focus more on cardio because strength isn't important. And I just stared through him. And if he said that to me, he's said that to hundreds of other people. As with all these points, if somebody is telling you never to do something again, it's probably because they don't have the skill set to be able to help guide you there. It's almost never true. That being said, could there be a reality that maybe there is a different variation or modification that's going to be best suited for you based off of your new constraints, right? Yes, that's absolutely possible. I make modifications for people all the time. However, I never, especially just meeting somebody, I never make this blanket statement that they will never be able to do something anymore. There is a level of preparation, there's a level of training required in order to prepare the body to be able to get back to something long term. Now, if somebody is looking for this magic quick fix within a matter of a day or a week, yeah, that's not going to happen. But if someone's willing to commit to a more long-term process over the course of weeks, months, sometimes longer, then there is absolutely no limitation I put on anybody. The problem is, whether it's conscious or subconscious, people put a limit into how much work they're willing to put into something. So when they are not willing to put more work into it, they create this reality that tells them they can't get back to something. That is not the true statement. It is okay to say, I'm not willing to do the work to get back to that. That's okay. You're free to make whatever decision you want with your life. But that's not the same thing as saying, I can't do blank ever again. So you need to ask yourself, what's the priority? What type of effort and time are you willing to put into something? And how patient are you willing to be? But otherwise, if anybody ever says, don't ever do something ever again, and that isn't after working with you for years and being able to progress and seeing that you're just not getting over a certain point, and they're just saying that because they saw an x-ray or an MRI or you had a surgery and that's just what they've told everybody, then they are not the people that are capable of getting you there. But there will be somebody out there that is willing to explain to you the process that would need to happen to see that type of progress over time. So ChatGPT guided this first discussion. I hope that provided a little bit more context. Like, all those points were actually pretty good by AI. Like, we hear those things all the time with patients that come in, and I feel like a broken record because I repeat myself all the time, but we need to remember that this is for most people, for some people, this is the first time that they're ever actually hearing context from a health professional. So don't make the assumptions that everyone just has this understanding of these things that you do, right? We need to get back to spending more time with patients and actually educating them beyond just telling them what to do. Now, obviously I'm super biased, and I'm also super blessed to be able to spend a full hour like we do all one-on-one. It's not possible to do this when you have 4 or 5 people at the same time. It's not possible to do it as the orthopedist who spends 5 minutes with you and then they have 4 other people that have waited an hour to see them, right? This requires time within a single session, time over the course of someone's entire plan of care, and it requires buy-in from that person and a willingness in order to learn, in order to deal with uncomfortable things, which is unlearning a lot of things they previously believed to be true. So this is where healthcare should be going, where we're actually starting to apply or provide the context that allows people to actually understand the things that we're trying to teach them. It is not useful to make people feel like they need us forever. We need to provide them the skills to not need us over time. So if you guys like this, please let me know in the comment section below. Message me directly. Make sure you're following us on Instagram to stay up to date with some of the more like shorter form stuff. Otherwise, I'll come back and post some of these videos moving forward, and I'll see you guys soon.